Today I'm going to talk about cupping. And right off the bat, I just want to give a shout out to Michael Phelps. Do you remember him? Amazing Olympian swimmer. Several years back, he showed up to the Olympic pool during the Olympics with these curious, mysterious, dark, purplish circles all over his back. And everyone wanted to know, what is that? And the buzz began all around the world, cupping. People started calling my clinic. I was flooded with calls from young adults and athletes. I want to get cupping. Sign me up for a cupping session. So thank you for that. Grateful for the attention and the free marketing. But we have to talk about it, because what is cupping? And should everyone do cupping? How does it work? So I'm going to go through that. We're going to discuss the benefits of it and who's going to do it and who shouldn't do it. And we'll talk about it through the East Asian medicine aspect, of course, and we will look at it through the biomedical aspect. I'm your host, Melissa Lone, doctor of acupuncture and Chinese medicine, and this is But I Don't Like Needles. First, let's start off with the history. Although many people attribute this medicine to Chinese medicine, it's actually been around for thousands of years and been used all over the world. It's been documented that it was used in Egypt, it was used in India, it was used in Middle East. It's been done pretty much everywhere. And what is it? It is the use of cups, and bamboo horns traditionally were used, heated inside them, make a suction cup, and used on the body. It's been known that it helps not only with muscle pain, but also helping to reduce fever and to help with headaches and other benefits as well. The question is, how does it work? So when you look at it through the Western paradigm, you can look at it through pain relief, when you are triggering the body to release opioids and a natural pain relief kind of cascade. It's called the pain gate theory. You talk about the immunological effects. We're talking about the nitric oxide theory, where nitric oxide is released and it increases L-arginine, it increases blood circulation, which again has this neutrophil increase activity. It comes to sort of clean out the system, the body, when there's some sort of destruction being done. And then you have the hematological, when you talk about the detoxification, doing it over the lymphatic as well. It can increase the blood circulation and moving things out through the body. When you look at the actual mechanism, it's breaking up the fascia, as I say, when you're sliding it along the body. It also, when you do those cups, you might notice that there'll be things coming out of the skin. Sometimes you'll see a little bit of blood if you've already needled before, or you could see fluid that comes out of the pores. And we forget that the lungs in Chinese medicine, and even when it comes to biomedical aspects, the skin is very important, not only for being there as our skin, as a protectant, but it's also, we breathe through our skin. We also detox through our skin. This is how we vent things out of the body. What does cupping treat in the end? Well, obviously, it treats muscle pain. We know that, the fascia on top of the body that is covering all over, that gets tight when we are stressed. It definitely helps to release muscles if done in certain locations that are hypertonic. Every joint in our body has a beautiful dance of all these muscles working together. And if one of them gets overused, because we are doing certain athletic behaviors, or even just sitting at our desk and doing things out of a normal alignment, we're going to have a misalignment, and one muscle's going to overwork and the other ones are not going to work at all. So we need to release the muscle that is overworking, and this is a great way. But not only does it treat pain, through its use of blood circulation, it also will help reduce cholesterol. It's actually been proven to significantly decrease total cholesterol, low density LDL, and HDL ratio. It's also been utilized for reducing blood pressure because of this. It can help to prevent cardiovascular disease with this constant blood circulation. So doing acupuncture and cupping will do that in a natural way. With the reduction of blood pressure, you will also have a reduction of migraines and tension headaches from the muscles being tight around the head and the neck. It will obviously help you stay well, keep your immune system up by keeping that blood circulating and releasing pathogens from the body that will encumber the liver and affect your immune system. It's very good for moving phlegm in the chest by doing flash cupping. I find that this can reduce the risks of pneumonia. People that are walking around with this congestion in the chest, it will fester over time and it will develop into bronchitis or some sort of infections, or it can develop even into pneumonia. And so the key here is to get that up and out, and this is a great way to do that. What should it feel like? So it depends on the person. For some people who have a lot of inflammation, it's going to be very uncomfortable the first time you do it. It feels like a suction cup, like a pulling on the skin. And the goal is to sort of sit and sort of breathe through. And if that is the case, this is not something that you would want to do for long term. And I will say the more that we clean the system out and the more you do it, the less uncomfortable it becomes. For some, it feels amazing. It feels great. I like to describe it as something that I used to do as a kid, and I don't know if everybody does this. My family was perhaps a little unique, but we would stand in the doorway and we would push our arms against the door jamb as hard as we could. Push, 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 and then we'd walk away, and it felt like my arms could just sort of float up. That's what it feels like with cupping for me. It's like it's pulling on the fascia and pulling and breaking up all of those muscles, and it's just sort of squeezing and breaking it up, and then it's tight and you breathe and it releases a little bit more, and when then you take it off, it feels like you can fly. That's how I like to explain it. When people refer to cupping, they refer usually to dry cupping or wet cupping. Dry cupping is applying the cups to the skin. Wet cupping is when you actually do a little incision first and it bleeds, and then you put a cup over that. That is not technically allowed in California, and I don't believe it's allowed in the United States. However, I will say that if you've done acupuncture before cupping, which is very common and highly suggested, then it will bleed sometimes into the cups and have beneficial attributes. The other is utilizing no incision at all, and that's what most people that you go to are going to be administering. There are different types of cups nowadays. We don't use bamboo and horns, but we do use silicone most commonly if you go to a massage therapist. This is very easy, gentle. You can kind of pop it on. I think people do it on Amazon now. You can find them anywhere. That will help to do a little bit of cupping, and you can do it anywhere. It's not extremely intense, and those are pretty popular today. The secondary is one that uses a suction cup, where you put the plastic cup on and then you attach a mechanism that sucks the air out. And those are very popular because you can monitor the strength of the cups, whether you do 1 pump, 2 pump, 3 pumps like that. It can get from very light to strong. I personally like using these for my pediatric patients, and they are safe, and you can go 1 pump at a time and see how they can handle that. The third is the traditional version, which is fire cupping. Fire cupping uses glass cups, and there's many different sizes of cups. When you're doing fire cups, this needs a license to use this style of acupuncture. This comes with an education, because you are going to use alcohol drenched cotton balls that you would light. Use a hemostat, which is a tool that will hold that, and then you use the heat from the fire from the cotton ball in the cup that will make a suction, and then you pop it onto the skin. Oftentimes this is done over a liniment, East Asian medicine liniment, so something like a Posamon or Tiger Balm, and then it goes directly on the skin. Next question, what are the different styles of cupping? There's more than one mode and style of cupping. Yes, you can do stationary cupping. This is where the cups will be put on and they stay over certain muscle groups or location or areas, and they stay there for a little while, and you'll see some colors coming up or something coming out in those locations. You leave them on usually from anywhere from 30 seconds, a minute to a few minutes or 5 minutes. I don't like leaving them on too long. And then there is sliding cups, where you put the cups on the skin, and like I said, there's a liniment underneath, and then you slide that over the fascia. And then there is a third style that is flash cupping, and that is where you put it on the skin and you're constantly moving those cups around. They have different reasons, mechanisms for using them, and you would want to know what those are. First of all, the stationary cups I personally use for hitting large muscle groups. I also use it for, in certain areas, to really move lymphatic. The longer you leave the cups on, the more it drains or is more draining to the patient, and it's very moving. So this is not something you would want to do on someone who is very deficient. I, for example, had a patient call, and she had chronic fatigue syndrome, and she wanted to do cupping all over her body. And the provider who was working for me reaches out and she says, I don't feel comfortable doing that. I said, of course not, and I support you. Cupping, when you are going to an East Asian medical provider, is not done just for relaxation. And it's very specifically placed and done in a certain way, how long you do it, where you do it, particularly for your pattern and your diagnoses. So it's not for everyone. Not every style is for everyone, and definitely don't want to be doing it anywhere and everywhere for everyone. You want to be aware of the previous medical history, and this is a conversation that should be had before doing fire cupping and stationary cupping like this. The second style is the sliding cups, and this is what's very commonly used with athletes. I also find it to be extremely useful for people that are overall systemically stressed. When we become emotionally in fight or flight in this constant stress position, it's more than just a muscle group that has been used too much, overuse. It's more about this overall systemic tight fascia that is all over the body. And this is where sliding cups really shines. This is the person that when you slide those cups and you take the cup and you have, like I said, the liniment underneath, and then you have the suction cup, you can slide it along the fascia, and it will break up a lot of the lactic acid, of course, along the fascia, which is useful for athletes that are tight, but also for the emotional component of the person that's holding on and just can't seem to relax their muscles all over. This is perfect for them. They're going to love it. They're going to like it. It's this patient, they look for this, they ask for it, and it's uncomfortable and it's tight, but it doesn't feel miserably uncomfortable because they know it feels like it's releasing something they can't release. That's sliding cups. And you can do that along the erector spinae on the back. You can do that on the IT band on the side for those athletes. It's not the most comfortable thing in the world. The third and final is flash cupping. And flash cupping, when we do it in the clinic, relates to, for me, two things. Number one, we're talking about moving blood and chi and getting things up and out of the body before they go too deep. For example, if you are starting to feel ill or starting to feel sick, you will want to do some flash cupping to get this up and out of the body before it goes too deep. This is when, as soon as you start feeling that itchy throat, as soon as you start feeling that sore throat, you come in and we start doing flash cupping on the upper body. And that is going to kind of get things up and out and moving through the skin. And then there's also when you have that chest congestion that seems to sit in the chest of the body, doing this flash cupping and moving that flash cupping will break up the phlegm. So who should be getting cupping? I want to make sure that we are very careful and mindful that if you have chronic fatigue syndrome, you should not be doing all body cupping, and you should definitely not be doing cupping for very long. I would also be very careful when it comes to blood thinners. If you're on a blood thinner, you want to be wary of doing any cupping at all. It's really usually not necessary if you're already on a blood thinner because that moves blood. But if you are going to do something because you're getting sick, it has to be something that is quick and something that is not left on the body for any period of time. Also be aware when you're getting cupping that you want to not go out into the wind and the ocean after you've had cupping. It opens up the pores and leaves you vulnerable. So you want to keep it covered. And you also want to avoid any really greasy foods or things that are going to encumber the liver, because we are releasing lactic acid, we are having micro traumas, and we're breaking stuff up and is triggering the body to have this immune response, and it leaves you susceptible for getting sick. So you want to be mindful of that, drink lots of water, green teas, things of that nature, to kind of clean things out before you eat anything like that. Obviously, we don't really want you to ever eat that, but definitely don't do that after you've had a cupping session. So when you go to a sauna, oftentimes we will go to a sauna, and part of that benefit is that circulating the fluids in the body and detoxing out through the skin. You have too much to drink, you're sweating out alcohol. It's coming out through your skin. Many things that affect the liver and are hormone deregulating actually vent out through the skin. Our body odor changes. You'll notice sometimes your body odor will be worse because it's venting out through the skin. What you put in your body, what you eat, things that are trapped within your body that are unable to be processed by the liver will sweat out through the skin. And this is also why we give garlic for an herb, for example. When you're starting to get sick, garlic is one of those herbs and foods that we know help. And how is that? Well, it vents things out through the skin. If you have a whole lot of garlic, you're going to be sweating like garlic. You're going to smell like garlic because that's the pathomechanism, is it comes out through the skin. And with that, it opens the pores and it detoxes the body from pathogens that are going to encumber the liver. I have a great story in this relationship. So I treat firefighters. I love treating firefighters for all that they do for our community. And not only that, but they need it. They are constantly in pain. They're constantly having lower back issues. And why are they in pain? This is a perfect storm of reasons why they are struggling. Number one, they are in high stress situations. That puts them in fight or flight. This means that they are not necessarily in their bodies, not feeling things, and they have to do in crazy strength training and difficult maneuvers. Number two, they are doing it with crazy sleep hours. So they come from a deficient place. Sometimes they're in the middle of the night, they've only had 2 hours of sleep, and now they're putting out a fire somewhere or cutting someone out of a car. So again, this is putting them into a deficient state. Number three, and this is the big one, is the toxicity that they are around. They know this because they give them all sorts of gear now that protects them as much as they can. When it comes to their mask, when it comes to what they're wearing on their bodies, and they even put them in these cleaning mechanisms to actually help clean those suits. It's because they are fully aware of all the toxic chemicals that are burning, that they are around, if they are not only in the house that's burning, but even nearby. And even using all the apparatus and the things that they're having, they are still absorbing. And I know this because my patient came in and he was suffering from chronic back pain, and he was a firefighter. And the first time I did cups on him, they were black. And I have to say, this is not this patient. I see this all the time. They come in the first time and these cups, when I do them, are black. And then they come back and they're better, a little bit better, a little bit better, a little bit better. Their pain decreases. He was doing well. He was making progress, feeling better. And then one day he comes in and again, he's like, I feel like I'm back where I started. And I said, okay, well, what happened? Well, he went on a fire and he went in the middle of the night and he was in that call, and here he comes back in after one fire. And he was someone who was a little higher up, I believe a captain or an engineer. And so he wasn't even in the house. He was next to the house. And even though he's wearing all of this gear, that first cupping visit after that fire, the cups were black again. I honestly wish that I could have acupuncturists in firehouses every day, in their houses, every time they come back. I love telling this story for two reasons. Number one, the direct relationship to toxicity in the body and how it affects pain. And number two, the fact that, again, the cups and how they clean things out the body from the toxicity that does get trapped within the muscle layer of the skin. And finally, it really is showing you the proof is in the pudding. So it's very difficult, I understand, sometimes to pinpoint with clinical studies exactly the mechanisms with all different types of people, because we're all so different and unique, and we have different medical histories and different circumstances and different constitutions and genetic makeups. But the proof is in the pudding. You can see within this patient, from progress and from the circles that are being shown from the cups and from his decrease of pain and his mobility and his quality of life, and then after an event, coming back and seeing the dramatic changes in the cupping marks and in his pain level. Now, another aspect of the detoxification, cupping, and acupuncture in general that is not related to this story is how it affects our immune system and our hormones. When the liver is encumbered, this is a backup that occurs, and now we're going to have a reduction of our immune system. So it is a great method for early onset, and also what I find for these hormonal issues that arrive around these changes and transitions in our life. For example, around adolescence or around perimenopause, you are going to have more sweating. Maybe you're going to have more skin eruptions. You're going to have sometimes water weight and water retention, because there's this backup and this excess, and it comes out through the skin or it gets trapped in the skin. And the cups are a wonderful way to release these trapped fluids or toxins up and out of the skin, where that skin layer gets trapped. It's a really important dynamic. In East Asian medicine, the lung channel will relate to controlling and affecting the liver. And if the lung is backed up or in excess, the liver will suffer. So this is where the cupping plays such an important role from that paradigm. What should you expect afterwards? Most likely some circles or some red. If you're doing sliding, there'll be streaks or purplish marks of that nature. It should not be painful afterwards at all, but it will leave those marks. So just be mindful of that, and they should go away within a few days or sometimes a week. It should be common that after your treatment that you have circles, as you saw. Sometimes they are brown, sometimes they're purplish, sometimes they're red, sometimes they're speckled, and that gives you also, for us providers, a little bit more information as to what's being trapped. Sometimes nothing comes up but fluid, water, and that is that fluid retention that I was talking about that gets trapped in the skin, and we're getting that out. Sometimes it's more purplish, and that is dark blood stagnation, which is something that's chronic pain. And then you have the red kind of speckled cups, and that's heat that's being trapped that also needs to come. In the end, I just want to reiterate how fantastic cupping is, of course, but also to remind you that it is not the end-all be-all. It is a tool in the toolbox of a provider. And for the best results, oftentimes I find that doing the acupuncture is going to be the strongest treatment, and then the cupping is in addition to. Not every person should have cupping, and not every visit should have cupping. If you're coming in from a visit and you had cups and you had these dark circles on your back and they haven't healed yet, I personally wouldn't continue doing cupping. I let the body kind of fully heal, and that also helps me to know if it takes a very long time to heal from that, that's another pattern that I need to treat before I continue with doing more cupping. So just make sure that you have a provider who is aware of the different styles of cupping, the side effects of cupping, the reasons for doing cupping, and that you are doing it ideally in tandem with acupuncture, massage as well. But for me, I find the acupuncture really gets to the deeper root of the issue, and the cupping is fantastic for the more branch-like superficial aspect of the treatment. So that's cupping, and please respond, give us some feedback on your experiences, and let us know what you want to hear next. The information provided in this podcast is for educational and informational purposes only, and it is not intended as medical advice. Always consult with a qualified healthcare professional before making any changes to your health, medical treatment, or medication. The views expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of any medical institution.